Thank you so much, Chair Livingstone, and of course, Chair Kennedy, esteemed members of this committee. I'm honored to join you today to offer testimony in support of S67, an act allowing spouses to serve as caregivers. I'm pleased to join House partners Rep. Scanlon and Rep. Oral, whose bill is H216. In addition, Senator Tarr has a related bill in healthcare financing. I'm so grateful to the many people who've signed up to testify on behalf of this legislation, as well as the outpouring that I know I have and you have received for this bill. And I'm particularly grateful for the expertise of Mass Home Care, which is leading a broad coalition in support of this bill. So S67H216 is a simple and I would say compassionate piece of legislation. As you know, chairs and committees, state policy encourages individuals living with disabilities to get the care they need at home rather than in an institution if they wish. Under current MassHealth regulations for the PCA or Personal Care Attendant Program, paid care may already be paid by family members, by a son or a daughter, a grandson, granddaughter, aunt, niece, uncle, nephew, you get the idea. Care may even be provided by a former spouse. These relatives are appropriately reimbursed for their time spent caring for a MassHealth member who is at home rather than in a nursing facility. Yet there is one glaring omission to this family unit: the spouse of the person who is needing the care. This bill simply broadens the definition of family member to include the spouse of the person with disabilities. It directs EOHHS to seek a federal waiver if one is needed to make this change within 6 months of the bill's enactment. I'll just offer 4 quick points. Number 1, as you know better than most, there is a severe shortage of personal care attendants caring for MassHealth members with disabilities. The governor has called it a crisis level shortage, her words. One study found that there were 4,400 unfilled positions last spring alone. There are people on the waiting list, as you know, who can't get the home care they need. Allowing qualified spouses to serve as family members who provide the care will actually expand the pool of caregivers, which I would imagine then would reduce a wait list and allow more people to get the care they need to stay at home. Number 2, as of last summer, 26 states have implemented this reform. 13 of these states started permitting spouses to be paid caregivers during the pandemic and are now making this permanent. In addition, the U.S. Veterans Administration also permits spouses to serve as caregivers. So it's a trend. Number 3, a 2012 California study compared those who had a paid spouse as a caregiver with those having other relatives or unrelated individuals as their caregivers. The spending comparison found that the average monthly expenditures for all services were lower for those with a family provider. Additionally, there were better outcomes for those with relatives as paid caregivers. And of course, we know that the costs associated with at-home care is far, far less than nursing home or a nursing facility care. And then number 4, the continuity of care is a critical aspect, as you know, of care quality. Authorizing spouses to serve as caregivers reduces turnover among caregivers. A 2015 study found that turnover among family member PCAs was less than half of non-family member PCAs. And I know we all can imagine the complexity of caring for someone who is quite ill or having an acute condition. It requires a great deal of tracking, and the continuity here is supremely important. So today you're going to hear very compelling stories. I know of people with disabilities where spouses could make a difference in providing loving care. You'll also get this through written testimony. So I join my colleagues and many others in respectfully urging the committee to act on this bill for the first time favorably and report out S67 and H216 so that we can see it over the line. Thank you so much for your time.